Acetaminophen suppositories are one of the best hacks for infants and toddlers who are sick and miserable and not tolerating medicine by mouth. Maybe they're just bad at taking meds, they've got vomiting, they've got hand, foot, and mouth that just hurts too much. Giving medicine from a different route can be very effective, getting them feeling better. It can make them more willing to drink because the pain is controlled and they're better hydrated. This is something that I tell a lot of my patients with young, sick kids. Admittedly, these are more difficult to find and dose than it is your normal liquid medication. Obviously, liquid medication you can draw up in a syringe. You can kind of pick whichever volume you want. With a chewable, you can cut it in half. It gets a little more complicated after that. But with suppositories, they come in 80 milligrams or 120 milligrams. So you have to kind of play with the numbers and decide. You can cut them in half if needed. You could even cut them in a third, but then the accuracy is going to be a little bit off. So talk to your doctor, your pharmacist about the best way to do it. And sometimes these are not in regular grocery stores. I've sometimes not even found them at somewhere like Target or Walmart. They usually have them in pharmacies, like your CVS or Walgreens or something like that. Look for suppositories. Fever All is a frequent brand. There are also some usually like store brand or generic versions of these. Yes, some people do get a little bit weird because of the way the suppository goes in. It's really not that big of a deal. If you don't make it a big deal, your kiddo will make it less of a big deal, and it could save them an emergency department visit for something like IV fluids because they're more comfortable, better able to stay hydrated at home. I'm a pediatric emergency medicine doctor, obviously, but if you have any questions, reach out to your pediatrician.